My name is Glenita Thompson, and I am the director of a very large healthcare academic Trauma One facility here in Florida. I've been in the field for around 30 years. I don't want to say how long, but because I don't want to date myself. But what I do want to say, my talking point is on timeline. Currently, the Florida statute tells us that we can release records in a timely manner. HIPAA dictates that we have to release those records within 30 days with an extension of 30 additional days in the event that that's necessary. So we have to adhere to the strictest, right? So we adhere to HIPAA, and we do honor those 30-day turnaround. However, this bill proposes the language of 14 working days, which causes some stress for HIMers like us who release on average over 10,000 records per month, just request. And why do I have a concern about these 14 days? Number one, if we have lab results that require cultures, it's not uncommon for them to take 2 to 3, 4, 5 weeks sometimes to get those results back. So we could receive a request for medical records for a lab result. We are not able to honor that request because we're outside of that time. We are not able to honor the request because we haven't gotten the results back from the culture. The same thing holds true for pathology reports. If they have to send them out, because we call, going back to the labs, we do what's called send out labs. And so they have to go to a special, say New York or California, they have to send that specimen there in order for it to be resulted. And then we receive it back. The same thing with pathology. Historically, we see our pathology reports come back within about 3 weeks. Again, we're not able to honor that 14-day turnaround time. So our ask is to align the current proposed language with what HIPAA dictates. It says 30 days with an extra 30 days. And the other reason why I say that it would be burdensome to us is number three, if you have mental health patients, and you see that record we're unable to determine if those records would produce harm if the patient were to read it. So we have to get approval from that physician. If the physician is out of the country or not here, we're not able to honor their request again. So again, the ask is to align the proposed bill to be with what HIPAA dictates. And the last thing I wanted to point out is that the financial analysis says that, or the analyst says that the analysis shows that there's no financial burden. That's inaccurate. Because if we have to honor the 14 days, that's going to require us to increase the amount of staff that we currently have in order to meet that turnaround time. Currently, we have 29 FTEs honoring the request for a 30-day window. So now you're asking us to increase that by 50%. Okay?
Representative Stevenson, then Rommel.
Thank you, Madam Chair. There was a comment about physician notes and residents and not done till they're reviewed by the
Yes.
Supervising physician. Is there not a way that you can just to have that part of the record tagged as not final so it wouldn't drop in your response? It seems like with technology we could overcome some of these concerns.
Currently it is, but if we get a request while the patient is still in house and it asks for any and all medical records, and that note from the resident or from the ED scribe, it's pended. So if you're asking for it, we have to release it, right? So are you saying that we should not release it only if it's completed?
Well, Madam,
You're recognized.
I guess that was my question, if that is not a final part of the work notes yet, because it's still being reviewed to make sure that it's full and representative of what occurred, that could be, it doesn't seem like it's an unsurmountable
You're correct.
obstacle, nor does pharmaceutical, test or lab tests being outstanding. That seems like those could be, there's ways to address that as a pending report, and not in that this is not the complete medical record. It just seems like it is not something that can't be overcome. But I really appreciate you being here, and thank you, Madam Chair, for
Thank you.
entertaining my
Representative
questions.
Rommel.
Thank you, Madam Speaker. I just want to make sure I heard you correctly. You said the 14 days would be, very difficult to comply with because you said the average lab and pathology report takes over 3 weeks to get back?
There are some, not all, but we do have labs that are called send-out labs, we have to have those sent out to another facility. And it could take, if you're waiting for a culture, it could be where it is 2 to 3 weeks.
Well, quick follow. I
Yes.
know there are circumstances with that, but you said average is over 3. So what
I
percentage are in
apologize.
send-outs?
Our send-out's probably about 30%.
About 30%, and they take 3 weeks to get back.
It could take 3 weeks to get back, along with our pathology reports.
Thank you.
Thank you. Further questions? Representative Burton.
Thank you, Chair, and really this is a follow-up on the previous line of questioning. I'm reading the bill, the proposed bill in front of us in line 154, clearly states that the correct copy of all records in the possession. So if you are not in possession, meaning the lab results aren't back, you don't have you would just be required to provide what is in possession. So I'm not quite sure how you see that, meaning that you can't say anything if you don't have the lab results back.
That's correct about the lab results, but if we're looking at, say, a discharge summary. So the patient's been in-house, been discharged, so they have a note that shows that what happened during that transition of stay, or what happened during the stay. If it's done by the resident and it's still in an incomplete status, so we can't release that information until it's signed by the attending. So if you're asking to see that discharge summary, and you only want the discharge summary, well, we have to wait until that's signed, right? So if it's beyond the 14 days, then we're not compliant with the Florida statute.
Representative Burton.
Well, I would respectfully disagree with you because it says in possession. If the report is not complete, then you are not in possession of the report.
So the report is actually, it lives in our Epic system, so I could print it out and have it in my possession. But the problem is, it's still not, it's not legal until it's authenticated by the attending of record.
Follow up? Got it?
That's good.
Okay. Further questions? Thank you so much for being here. We appreciate it.